Meeting. I'd like to call the Mason County Board of Health meeting to order, and I can't really tell from my screen who's on there and who isn't. I see Sharon and Kevin and Gary and Kathy and Abe and I guess Randy. And Diedrich and Carrie Davidson and Katie Hayes. Who have I missed? Anybody?
I'm representing, I took Scott Hilburn's place. I'm representing Mason Health, Darren Moody.
Darren, okay. Anybody else? Oh, did I say Dave? Dave, you're there, aren't you? Still?
I'm here.
Okay. So can I get a motion to approve the agenda?
I will make a motion to approve the agenda.
Second.
All those in favor?
Aye.
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 All those opposed? I don't hear any opposed. And Lydia's joined us. Okay, so we have a chair, but like last meeting, the special meeting, I couldn't attend. And so I asked Carrie to run it for me. And I'm wondering if maybe we want to appoint a vice chair.
I move that we appoint Carrie.
Yeah,
Do I have
I will second that.
any discussion?
Is that just in your absence, Peggy, if that
Yes,
works?
as a vice chair. So if I can't be there, maybe you could run the meeting.
Yeah, I am happy to do that. I just, if I end up with a special school board meeting that conflicts, I may not be available, but hopefully between the two of us, we can coordinate things like that.
Terrific. So all those in favor?
Aye.
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 Any opposed? Okay, so you're it. So can I have an approval for the January 26th minutes?
So
Or
moved.
can I have a motion to approve?
So moved.
Second.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Any opposed? So hearing none, that passes. So we'll go on to the health officer's report. Oh, I forgot to say that Dan Stein was there. I guess you'll know that now. Dan?
Hi all. It's good to see all you guys. Coming to you from rainy Minnesota. I feel like I'm right back at home in Washington. So, no, of course, right now everything is focused. Everything that I've been doing is focused on COVID. As we've started seeing some plateauing of the descent. We're hoping that that is just a plateau and not a new spike, but this is likely a result of some adjusted behaviors as well as some new variants that are becoming more prevalent. So the DOH is tracking those numbers, and we haven't seen a whole lot of that in Mason County yet that I'm aware of, but that's definitely something that we're going to be monitoring. The staff has done a great job, as far as I'm hearing, of distributing vaccines, and I've been hearing a lot of rave reports from everyone who I've heard from. And I'm really just proud of the team for really reaching out to the community and also utilizing community partners to help distribute this really vitally important vaccine tool. We've been looking also in terms of reopening schools to more in-person training. And we're getting some new words from the governor and the CDC about how we can move forward with that in a more effective manner. It sounds like the governor at this point is maintaining the 6-foot distance between students, which is kind of limiting some of the schools from getting back full time. I have been in discussion with the superintendent on about a monthly basis just to check in, make sure that we're opening up as quickly as we can. I know that Dave is going to be, part of Dave's report is we're going to be talking about the future direction for the health officer search. So I'll kind of leave that to him, but I'll chime in at that point. And that's about all I've got to report.
Okay, thank you. And so I guess, Dave, you're up.
Okay. So starting off with the vaccine rollout, you know, back in January, it was off to a bit of a bumpy start. And that continued for a while, but we do now have a 3-week forecast from DOH on what our vaccine availability is going to be, which gives us more dependability on our ordering as we go with Mason General and Peninsula Community Health Systems as our 2 primary providers doing the mass vaccination clinics and the pop-up clinics. So with the 3-week notice, that gives us, like I said, more dependability. We don't have access to Johnson & Johnson just yet, so we're back with Moderna and Pfizer. I'll have let Vidya talk about the vaccine clinics themselves. Vaccine rollout.
Dave?
Yeah.
So on that, I was in a meeting this morning at the hospital where there was talk of Walmart pharmacy.
Yeah, so
possibly.
The pharmacies are getting into the game now. So we have Walmart. I've been in communication with Walmart, Safeways, QFC, Shelton Pharmacy, the Medicine Shop. A lot of the smaller pharmacies are starting to get stocked with their initial doses, and some are even starting to see their second doses come in. So those
the rumor of the Walmart one today was that they were getting the Johnson, the 1 dose, whatever that is.
And they may, that's not part of, see, they're going through a federal system, and I don't have access to the federal system. I've just got access to the state system. So what they get is kind of a surprise to me until they tell me about it. But Walmart's been doing a pretty good job of keeping us in the loop on what they're doing. So it factors into the group B2 group about congregate workers, grocery store folks. Those pharmacies are taking care of a lot of their own people first, and then have now branched out and are doing appointments with the public. So I was down at Safeway just the other day, and they had folks in line to get their vaccine. So we're starting to see more and more of that. That will alleviate a lot of what we're doing in our numbers across the vaccine rollout. So if you look at Mason County and you just take roughly 70,000 people, take 20,000 off of that 70,000 for kids under 18. We've already started about 20,000 vaccinations for the 65 and older. So take that group out. So that leaves a smaller group of about 30,000 people. Take out a portion of those folks who don't want to get the vaccine, and we're starting to get it to a much smaller group. And I'm thinking probably by the end of May, we will be out of the mass vaccine business. And I'm hoping that the pharmacies will have the stock, and the pharmacies, hospitals, clinics will have the stock in order to keep that ball rolling. I think the majority of the population should be through the process. I'm hoping by the end of May, especially since we're going to open it to everyone over 18 as of the 1st of May. I think it'll go pretty quick after that. So that's good, because it's kind of taking a toll on our vaccinators and our volunteers and staff to go out there and do these clinics. For example, we have a 1,200 second dose clinic on Thursday. And the one we did last week, we did quite a few folks, over 600 folks in a downpour. And it was kind of miserable out there. It gets to be a long day when you're doing those kinds of numbers. So vaccine rollout is looking better. We're getting, like I said, the Johnson & Johnson, 6,000 doses into the state this week, but we haven't seen the ability to order that through the state system yet. That's pretty much it on the vaccine rollout for my piece. I'll let Lydia talk about the clinics themselves. Questions on vaccines for me?
Nope.
Okay, all right. So phased recovery, we're in phase 3 right now. And actually, this is the first time that the governor's office has had WSALFO and Department of Health work together to make some recommendations. So we put together a work group very quickly about 3 weeks ago, made our recommendations, hashed some things out on several very quick meetings, gave those recommendations to the governor, and the governor actually took those recommendations and maybe went a little further with it than what we had asked for phase 3. So we expect to see the same kind of work group stood up here pretty shortly to go looking at what would be required for phase 4. So expect to hear something on that at any time. We did have a meeting last night with the health officers to talk about the school piece, about school recovery and moving into a 3-foot distance for in classroom. And what the health officers voted on last night was recommend to the governor that we go with the CDC guidance. So we have the same guidance at the state as we do with the CDC, just keep everything consistent. So more to come on that. I expect to hear something from the governor's office tomorrow, next day, sometime this week on that piece.
Dave, I was just
Schools.
to
Yeah.
follow up on that. I wasn't at that meeting, but from the emails that I was seeing from the governor, it sounds like his plan is not to adopt the 6-foot until much later.
Oh, well, that's interesting because Oregon adopted the 3-foot radius yesterday. So
It's just based on a single email I saw as of yesterday in response to the calls from the calls to have him move it. Again, I'm far removed from the situation, but that's just what I saw.
Yeah, so we made a recommendation to go with the CDC recommendation at the meeting yesterday, so we'll see what happens with that. Phase recovery is going to help here locally. We're already starting to talk to folks about sport events and what they can do and food trucks and those sorts of things. So starting to get those normal springtime activities rolling again. That's about it for phase recovery. Any questions on that? Okay. So next thing is health officer search. So the personnel committee met a couple of times. We interviewed a couple of candidates, selected one who declined the position, not because of anything to do with the position, but because of some personal things. And so we're back to where we were, folks. I'm asking you now for the kind of the board's direction on, do we want to reopen? Actually, the position is still open. To keep going on this, I have a number of candidates, one local. I've got a couple that are in Washington. One does not have an MPH, one does. So kind of looking at for some guidance from the board on how you'd like to go forward. And I'm sure Dr. Stein wants to weigh in on this as well.
Yeah, what's your opinion, Dr. Stein?
Well, as I've always been saying, I want to make sure that I'm leaving the county in good shape and with a good successor. But of course, I also can't do this indefinitely. When we had when we were offering it to the last candidate, Dave had mentioned that wanting me to stay on for a month after they started in order to help facilitate transition of the role. And I, of course, am happy to do that. I'm thinking that, hoping to be away from this position by July at least. But
Yeah.
I just have to make sure I'm not doing this indefinitely.
Right. So does anybody else have input on this?
Dave, is the local candidate a different candidate? These are all new candidates potentially.
Well, this is one we hadn't interviewed. This one didn't have a Master's of Public Health. So it's what I could do is send out what I've got to the personnel committee, and we screen these and then go from there if you'd like to do that.
That sounds good to me,
Okay.
because we have to get moving on it.
Hey, Dave, just out of curiosity, as with most searches, I imagine there was a pool of candidates, and I'm not privy to what was going on, but was there a number 2 or number 3 in that role during those interviews that maybe is qualified?
I think the personnel committee had some strong feelings.
Just,
I would,
and then
I
the
was
other-
on the, I was on that interview, and I for one, would hope that we would look and go back out rather than the second choice.
that answers the question. Thanks, Randy. The
Well, and our biggest concern was that the second person, there were two, and the second person had significant other job duties that would prevent them from being, they would not be living in Mason County, and they would have to balance this job with other jobs. So,
And I kind of felt that Dan was doing as much as that one would be able to do.
So another question, Dave, did you ever consider having, so that Dan gets some relief in here, maybe appointing an interim and opening it up and letting the interim apply?
So-
Like the local person you talked about?
Yeah, so we've reached out to some of our other health officers for backup. So we do have the ability to back up if something happens. I can get hold of Scott Lindquist at the state, and he can back us up short term. We looked at sharing a health officer, and that's something I'm still exploring. Can we share a health officer with another health jurisdiction? So that's something to look at as well. So we're working those avenues. For example, Clark County is covering 5 counties now. So he hired a second health officer to help out with the smaller counties. So it's just something we might be able to do, a mutual aid agreement with another county, and we're still searching through that. Part of the problem has been COVID, and our health officers have been swamped. So they said, we would gladly do this after the pandemic.
Right.
And of course, that's kind of when we need a health officer during a pandemic. So, we're exploring other avenues as well.
Okay, so maybe send it out to the committee and we can look at that.
Okay, will do.
Dave, can you include me on that?
Yes. We can
Yeah,
include you.
I would like to see that also.
Okay. Will do.
Thank you.
Okay, moving on down to fiscal. So, there's a lot of money coming our way in a way. That takes some clarification. A lot of COVID money is out there. One of the things that has come to us is that some of it comes with some strings. For example, in order to access some money for the actual running of our vaccine clinics, we would need to join a multi-county incident management team. We'd have to request an overhead team come in from the state, and they would be here for about, they would be done at April 20th, I think. And that would give us the ability to access funds but it would be a regional management team. They would come in, and we, and when I say we, I'm talking Mason County, Jefferson, Kitsap, Clallam decided as a region we weren't going to do that we were doing things on our own as our counties. But what the state has done is they have cut off any money. So we can plan and we can advertise, but we can't actually conduct or administer the clinics with the funding that would be coming from the feds or this other state money. So we have other sources of funding. We had already planned to move forward with the clinics, so I'm not too worried about that. The state is about 2 months behind in getting the consolidated contract amendments out to us. Things we put in for last November promised to us in January to help us through first quarter still have not arrived, and first quarter almost done. So we're having those conversations with DOH saying, where's our contracts? This is a little bit late, especially if we're trying to use some of these funds by the middle of April or the end of April, and we haven't even received our contracts yet. It makes it a little difficult to spend that money. So working with the state, trying to get that kind of squared away. Local dollars, we're doing pretty well as far as fee-for-service work is coming in, and that's kind of in Alex's report. So overall fiscal, we're looking pretty good, but there are some things we need to tighten up from the state to get our contracts in place and the ability to build those funds. One of the funds, for example, is called the ELK Fund, which allows us, like I said, to do planning. We can do community outreach. We can do translation services. We just can't actually run a clinic with them. So I think we'll be okay. I don't see any major storm clouds on the horizon for our fiscal piece. eventually the pandemic will end and we will move forward into our normal line of work. And that's one thing that we're not doing probably as well on with our staff involved in running the pandemic. They're not necessarily working as much in their own programs, which are programs that we normally bill for. So they're already in contracts that we would bill for. It's kind of a double whammy. We're having to spend cash out of pocket, and then we're not getting reimbursed because we're not billing the programs that we normally bill to. So it will work out. We've got the pieces in place, but it's kind of a double-edged sword on some of those fiscal pieces. Any questions on that?
Anybody have questions for Dave? Okay, I guess we'll,
Okay, I got a couple other things real quick, if I could.
okay, sure.
So the county health rankings are coming out. I'll be getting the embargoed copy this Friday. And then the county health rankings are coming out, I think, April 1st, which is a week from now. So we'll see how we're doing county health rankings. And that's gonna be really interesting to see what happens with our data over 2020 compared to 2019 and 18. You know, are we gonna continue the trends of improvement? You know, what will actually happen? So I'm going to be looking a lot at children in poverty and suicide ideation. A lot of the self-reported issues that show up in the county health rankings are going to be really interesting this time. They're coming out with not a lot of fanfare because they really want to focus on the pandemic issues, but it'll be interesting to see what the county health rankings have to say. So as soon as I get those and do a quick analysis on that, I will shoot that out to the board. Trying to keep the board apprised of a lot of things I'm looking at. You get a lot of emails from me, and I hope I don't flood you too much, but there's some really interesting stuff going on out there. And then kind of lastly, I'm working on a document. It's kind of along the lines of the one I wrote last year on Vision 2020, but it's kind of around community services 2021, looking at the mission of community services, and then looking at public health and community development departments and seeing how we are or are not meeting the missions and what we need to adjust to make those missions work, and doing some research pieces that go along with that to back up some of those things we're working on. So just as an example, if we were to take the piece around diabetes, obesity, and chronic disease, that's one of the things that's not funded. And looking at some of the statistics I was sharing with some of the study I've done, it looks like the United States is on track to be, by 2030, 60% of the population obese, 30% overweight, and only 10% at normal weight. So that's a trend we really need to start reversing because we found in smoking, in order to change trends, sometimes it takes a decade or more to get trends reversed and moving in a different direction. So you'll be seeing that in May, so prepare for a little bit longer board meeting in May as we go through that document. And then I would like to, as soon as it's allowed by the governor's office and our phased approach, to have a retreat for the board and really sit down and kind of talk about board engagement and how we move forward with public health into the future. Like I said, I really have a strong feeling about not communicable, but chronic disease, the things we know that kill us, and how are we going to address those going forward. So we'll be seeing that. Hopefully this summer we can get together and see each other in person and maybe have a retreat. I've talked to Jean Clark from Cascade Pacific Action Alliance, who's willing to act as a facilitator for that discussion. She's really good at those sorts of things. So you'll be seeing a lot more from me in the next couple of months as we move forward into the summer. Hopefully we'll have an active and healthy summer.
Okay. Any other questions for Dave? Okay, Alex, you're up.
And Alex may not be on here. I think I got him setting up
He
traffic. Was he on here?
I thought he was at the beginning. Oh, well.
Yeah, I think he's out right now setting up traffic cones for the clinic.
Okay.
So he's out there doing that good work. So you have his report here in hand. As you can see, our environmental health permits month over year, we're up quite a bit. So our EH permits for 2021 are at 120 plus, where normally we're around 100 or fewer. So it's cooking right along. We're just not seeing a downturn in building. We're seeing a lot of outflow from Seattle. I was looking at some of the estimates from Seattle as much as 3.3% leaving Seattle. So that's like a 30,000 outflow from King County going other places for housing, and they're coming here. Our market is very hot right now. Houses are selling the same day that they are hitting the market. So people are buying property and developing property, and that's kind of driving a lot of our environmental health work. So hopping out there, as we get into more things open, you'll start seeing more of our food permit work going out. So those things are starting to hop. It's just going to be a very active spring. Public health in that instance doesn't shut down because of the pandemic. We have those things that need to keep going. We still are doing shellfish work out there, still doing solid waste, still doing on-site septic and wells. All those things are still cooking right along. So with the pandemic, hopefully we'll be able to put even more energy into that. We're using some of our environmental health staff every week to support the vaccine clinic. So it's at least one day a week that staff is pulled out of their normal work to go work the vaccine clinics. And they've been doing a great job. We were just really cooking folks through last week. I think we were doing 6 cars every 2.5 to 3 minutes out there at the airport. So really getting the folks through quick. And that's reflecting on the environmental health staff, the community health staff, our volunteers, and our hospital partners have done a great job in getting that stuff done. So it's all hands on deck when it comes to vaccine clinics, and environmental health is certainly right there.
Great. Okay. Any other questions for Dave on Alex's report? Okay, so I guess we move on to Lydia.
You're muted, Lydia.
Lydia, are you there?
I hear you, but my mouse won't obey. I have 3 screens.
Okay. Gotcha.
So sometimes I can't get my mouse to go to where it needs to go. Sorry about
Okay.
that. So good afternoon, everybody. I sent you my report, and as you can see by reading that report, over half my staff are still working in their areas, in their programs. My housing staff, behavioral health staff, my nurses, and my community health environmental specialist is the 3 that aren't. And then we have an added person who works strictly COVID, handles the COVID phones. And now we've enlisted her on Thursdays for the mass clinics because we needed her out for data input and registration. So we're kind of cross-training her in all kinds of things at the same time because the phones have been rather quiet, especially on the day when we're doing the mass vax clinic. So anyway, they're real busy still and staying real active. With COVID, we're still having, a few cases every few days. And so it's low, which is a relief when you're busy doing all the mass vaccination and answering those questions. But I have to admit, the staff has gotten that, and the volunteers and the hospital have gotten that to a well-oiled machine. Wouldn't you say, Chief? Ex-chief. We've got that
Former
down.
chief, how's that? Former chief.
Former chief, thank you. Former
You know
chief.
what? I was singing the praises at the hospital to all the staff there, and I'm singing praises out in public left and right. Lydia and Dave will tell you that I took my parents through the clinic on the first 2. And the first one we went through, and I think we were in and out of that completion by 30 minutes. And it was so nice to be sitting in a car, comfortable, while that was going on, because I also attended the Belfair Clinic at the school up there. And while it was organized, I felt really bad watching people stand outside for over an hour after their appointment time, the vaccination. And then the second time, I understand you guys vaccinated a little bit more in a shorter amount of time. So it took a little bit longer, but it was still very efficient.
Thank you. Yeah, it's going well. We get lots of, matter of fact, somebody just wrote something in and said they had been to numerous clinics around the state. I don't know who they were, and that they felt ours was the best run in the state. So, that was pretty good. Praise. So we do have it down. We've made zillion changes every time. There's some change that we do, but it's been exciting to see that it's getting more efficient each time. And the people seem happy. They'll be happier when they can only come for one and not have to come back for a second. And it's true, there are numerous places that have the Johnson & Johnson, but it comes from a different source, and we do not and we don't expect to see it for a while. So we'll continue on. Tomorrow will be Thursday will be our 8th mass vax clinic that we've done, and it'll probably be our largest. We actually have over 1,100 registered. And so hopefully it'll run smoothly. I did the first time we did it, so hopefully this will run even smoother. I'm excited about that. Anyway, and then we're still dealing with some COVID and still dealing with people that need help with COVID. So that's still going on in the background. I'm not as busy as it was, thank goodness. It would be very difficult to do all mass vaccination and handle the height of COVID as it was months ago. So it's nice that it slowed down a bit. I've got Abe is on, and he is going to do a presentation for you guys about some of our new programs that are going on in the community. Abe, we continue to do brand new pilot programs in Mason County, and then we figure out how to sustain them, and they're working, and it's exciting. So Abe, are you there?
I am, yes.
There you are. I don't know who has control of the screen that they could share it with Abe. I do not.
I've got the option here. We'll see if it works.
Okay, go ahead,
Great.
Abe.
Everyone see that?
Ooh, yeah, worked, Abe. Go, Abe.
Okay, so we'll just jump in. Good afternoon, everybody. Appreciate the opportunity to present on a couple newer projects here in Mason County. And want to kind of just do an overview of each kind of program and project, both the law enforcement assisted diversion program and our newer behavioral health navigator program. And then kind of just go over a little bit more about what's going on with our behavioral health system as a whole and kind of where all this fits in. I have a little bit of data to share as well from each program. So, and also want to encourage you, if you have any questions along the way, please feel free to let me know, and I'll do my best to answer those questions. So jumping into LEAD. So LEAD is law enforcement assisted diversion. And our LEAD program focuses on public safety and order by utilizing harm reduction principles to support individuals experiencing behavioral health issues. The overarching goal of the program is to improve community health and safety by using specific human resource tools that are coordinated effectively with law enforcement as well as other community stakeholders. Now, as with a lot of our projects, and you'll see this is a theme throughout my presentation, is none of this would happen without the partnership and collaboration that's been happening and continues to happen in our community and in Mason County. You see that we have I have a list of our lead partners here. And I just kind of want to highlight a little bit about where their participation is taking place. So public health is working at the policy level and the operations level. Prosecutor's office is doing the same. The public defender's office is helping us at the policy level. The sheriff's office is at both the operations and the policy level. Shelton Police Department is also involved in the operations level as well as policy. City of Shelton is helping out at the policy level, and Olympic Health and Recovery Services is our case management team. And so they are also on the policy level as well. And then the Northwest Justice Project has joined us in with input at the policy level also. So some key components to our LEAD program is it really does emphasize a balance between public safety and individual health and well-being. And it creates the option for law enforcement to really be an active pathway to recovery, which I think is vitally important, it really is a tool in their toolbox, and helps them in the field. And in our community, they have really taken to this program. We're really excited about that partnership. Another key component to our program is that program participants are working with peer case managers. Over the last several years, we've really emphasized and really worked on increasing our peer workforce, because data shows that folks that have lived experience, that kind of speak the language, really have a more positive impact when they're working with folks that are dealing with behavioral health issues. So this program, our lead outreach team consists of an SEDP and 3 peer case managers. Another important aspect of this program that I like to highlight is there are dollars not only supporting the program, but also the participants in the program. So a lot of times with grants, it's let's fund the position to create the program, but then there's no dollars kind of on the back end. So with this program being funded through the Healthcare Authority, we have dollars that can go to housing, that can go to food, that can go to work clothes, that can go to any of those recovery supports or anything needed to help people along their path of recovery. LEAD is a person-centered harm reduction-based program, so it's not a requirement for folks to be abstinent to be a part of the LEAD program. Now, of course, it is a goal for folks to be on a path to recovery, but it's not a requirement right out of the gate. And also want to highlight that LEAD is a voluntary program. So folks have the option to say, no, thank you, I'll go through the criminal justice system per usual, or yes, I'd love to be a part of this program. And then we kind of get them going. So it is a voluntary program. And there are multiple referral pathways to our program. There's arrest diversion, social contact, and a community referral. The first two, the arrest diversion and social contact, law enforcement is the gatekeeper. And then of course, community referral. Any agency in Mason County can refer folks into our LEAD program. So kind of baseline, basic criteria for our LEAD program here is folks that are dealing with SUD or co-occurring. So SUD being substance use disorder or mental health, and then extreme poverty as well. As I said, law enforcement is the gatekeeper for the arrest diversion and the social contact. In our arrest diversion, we have 16 law violations that are make up our program criteria. And that's something else I want to highlight there. So when we started putting together kind of the policies, procedures, protocols for our program, and we had everyone kind of around the table, there was a lot of conversation and folks with open minds saying, hey, how can we best set up our program to include as many people as possible? And a lot of other programs in other jurisdictions, they have maybe 6 to 8 different law violations that would make up program criteria. And our law enforcement partners and our prosecutor's office said, hey, let's expand that. So I think that's a real testament to our community being open-minded and really wanting to open up that pathway for folks to really get the help that they need. Of course, law enforcement discretion and interaction are imperative, as they kind of know what the folks they're working with and dealing with in the field. That way, appropriate referrals are made. So social contact is the absence of a law violation. This is kind of a proactive option for law enforcement. So if they know folks, whether they've worked with them in the past, they've dealt with them in the past, it's a family they know, or it's a call where there's really no law being broken, but they know either from history or through conversation that there's a behavioral health component to it, and this individual could use some help and support. Law enforcement is able to proactively refer them into our program. Our newest referral pathway is the community referral. Another highlight to Mason County really stepping up to the plate and doing things a little bit different and really trying to provide as many options as possible. I think currently we're only the second program in the state to offer this community referral. So what other agencies are able to do is they can jump online. HealthyMasonCounty.com has our referral sheet, and they just fill that out. That gets sent into the program coordinator and outreach team, and then it's triaged appropriately. Folks, need to meet the basic criteria for LEAD, but it's a really cool deal that Mason County was able to put together all three of these referral pathways. Some data. So we signed a contract back in June of 2020. It took us a couple months to kind of get the protocols, procedures, those things in place. So officially, we started the program September 1st. As you can see, our year one goal was 50 individuals referred into the program. Currently, we've had 44 total referrals. Out of those 44, 14 have been arrest diversion and 27 have been social contact. So as you can see, officers are really using that proactive approach, which I think is a fantastic, fantastic to know and to see through the data here. And so far, we've seen 3 community referrals come through. We anticipate that portion of the program will grow here as we move forward. But as you can see there, it just started in February. We have 37 open and active cases. So again, it's that willingness piece. You can lead a horse to water, you can't make them drink. Offering all the options that we can. So there are a few people that haven't engaged yet. Prosecutor's office, they're allowing some leeway and some freedom and not really drawing a hard line. So we're still attempting to engage with those folks, still giving them the option to say, hey, you've been referred to the program. We'd really love to be a part of the program. And so still putting in the effort to get those folks into some, being active. And our lead team continues to encourage referrals, whether it be community or with law enforcement. We actually have a follow-up kind of Q&A training as well for Shelton PD here on the 1st of April to kind of, just check in and see how things are going, see what questions we can answer. That way we can continue to get referrals as it's a fantastic program. Any questions in regards to LEAD so far? Okay.
Hey, Abe.
Yeah.
One thing, for those that don't know, in today's world of criminal justice, if they don't get into LEADs, they're not even going through the criminal justice system, most of these people. They're just, the court cases are being put off. There's people that are 2 years out from any kind of court cases and so I think what you're doing is a great thing. So that may be something that you might want to think about in your talking points as you're out in the community is, hey, the truth is most of these low-level offenders aren't getting anything through the criminal justice system anyways. So what can we do to help them stay out of the criminal justice system and not be the burden? So just a thought. Yeah.
Thanks, Darren. I appreciate that. Absolutely.
And I wish you'd take the Mason County Sheriff emblem off the first of it and put a Shelton PD emblem. I'm just saying.
Well, I can do that for LEAD. The sheriff's office one kind of, that's a segue to this portion of the presentation. So I thought you were former chief. No, I'm just kidding. So jumping into the next and the newest program is a Behavioral Health Navigator program. And this is currently a partnership between Public Health and the Mason County Sheriff's Office. Kind of the main goal of this program really is to connect folks that are dealing with behavioral health issues and are in need of any other recovery support directly to resources. And in doing so, of course, it provides some real-time support to deputies in the field. And so far, it's the program's been going really well. We started it back on February 1st. And so we're just at beginning stages, but some of the other goals of this program and what it's providing is it's for the sheriff's office. providing the opportunity to have someone that's kind of plugged into the behavioral health system. As we know, things change constantly, insurance companies, agencies providing different services, what new partnerships or collaborations are happening, and all kinds of different stakeholder group meetings and coalitions, those kinds of things. So this was one of the main reasons as well that we partnered, that public health partnered with the sheriff's office to get it up and going, is that there wasn't a need to bring someone in new to the community, as public health has worked really hard and put a lot of energy over the last few years working on developing and helping to create a lot of the behavioral health system. It didn't take any time to do some of that onboarding. And the ultimate goal, of course, with this program is to reduce a lot of the kind of repeat calls and interactions with individuals that are dealing with behavioral health issues. The target population of the program is basically anyone that's experienced behavioral health issues, whether it be substance use, mental health, similar to folks that would qualify for a LEAD program as well, but are just in need of being connected to the system. And of course, anyone needing recovery support. You see, I've got some examples there of what we're looking to connect folks to, whether it be housing or peer support, legal support, MAT, Narcan, and syringe exchange services. So wanted to provide some quick data. As I said, we just started the program on February 1st, and this is through March 15th. So far there have been 22 referrals. 13 of those referrals have been connected to services. 5 of those 13 folks were eligible and were appropriate for LEAD referrals. And also want to highlight that it's not just pre-arrest or if individuals aren't going to jail, but even when folks are transported to the jail, we've kind of set it up where, let the navigator know that you're bringing someone to the jail if you feel like they're in need of some support. And we've worked previously to create a relationship with the MAP program, as well as the reentry and mental health program in the jail. So that way, folks that are being transported, we can call ahead and say, hey, so-and-so is being transported currently. These are some of the concerns. Put them on your radar. Let's make sure we meet with them before they're released from jail. That way, hopefully, we get them those services before they get out. That way, hopefully, we can reduce some of that recidivism. Navigator is also currently lending support to other community agencies, most or particularly with clients that are likely or are currently having contact with law enforcement. So these are two programs that we wanted to highlight. Some of our newer programs. They kind of fit into what we've been working on for several years now, kind of a no wrong door approach. And I really wanted to take the time to just highlight, sometimes it's easy to think about maybe what's not being done or what we can do better or what isn't happening, right? So I really wanted to highlight and really, just in a place of gratitude for the amount of work that Mason County has done. And the partnerships and collaboration, as I spoke to at the beginning of this presentation, you'll see here is very evident. We have a myriad of programs going on here in Mason County. I know there's a lot more to come. I feel like we're creeping towards accomplishing the no wrong door approach idea. And just wanted to highlight a few of these programs, overdose and education and response, which includes our Narcan and naloxone distribution, our COPE, or which is known as COSAP now. That project is nearing its end, but I would imagine the spirit of that project will continue on. There's 6 different SUD providers that are continuing to provide data to us. There are 26 signed MOUs as a part of that project. We continue to have our mobile outreach working just fantastically. That's our syringe exchange. The QRT is working really well currently. That's a partnership with the Fire Authority in North Mason and PCHS. We've got our MAP program now in the jail that's been running well, and I think over a year now, well over a year. And there's talks of possibly expanding that program currently. Of course, the reentry program at the jail, and those both include partnership with Olympic Health and Recovery. There's a peer case manager over at the SOS program that's working in concert with the already established program there. And then, of course, the newest, the RCorp implementation project, and that's a partnership between Mason Health, PCHS, the Fire Authority, and Public Health. And I always want to highlight really the foundation of all the behavioral health and SUD work are the providers in our community, whether it be SUD or mental health, and also the crisis response and recovery supports. And if you haven't gone to healthymasoncounty.com, I really encourage you to. It's a great interactive platform. It's got a lot of local data. And if you have anybody that needs resources, it's got all those on there with quick links, and kind of it's a great highlight of what's going on in our community. So that brings me to the end of my presentation. If you have any questions, I'd be more than happy to field those.
Any questions for Abe?
Peggy,
Very
this
good
is
present.
Kevin. Just a quick question for Abe. So you mentioned that the target for LEAD was 50 referrals this year. Do you anticipate that we'll hit that mark? And if you can maybe just talk about some of the ongoing interactions that you're having between the two principal law enforcement agencies and the work that you did to get them onboarded and bought into the program.
Yeah, so I absolutely will meet that number and we'll exceed it. We have the program running until, or at least the grant, until the end of June, and that's kind of our year. And we're just a few referrals away from meeting that goal. And as far as onboarding both law enforcement agencies, we've had multiple trainings, kind of what the program is, what it looks like at the beginning of the program. And then we've had some follow-ups. We've had multiple follow-ups with the sheriff's office just in the last month and a half. And then we have our next one with Shelton PD here on the 1st of April. So just gives us an opportunity to kind of have some discussion and share some of the data and some of the feedback. That's one of the things we talked about at the beginning of the program. You know, for officers to have buy-in, as well as, you know, not to just make a referral and never know what happens to it, but what's that follow-up look like? What's that continued communication and the building of the program look like? So.
Yeah, I think this is a really exciting opportunity for the county and Shelton as well. I think it's just incredible the work that you and Lydia and Christina and Ben have been able to do on the outreach and prevention side, and just getting into these, you know, this pattern of achievement from public health. I mean, it's just been really incredible to watch. And, you know, this is something that I think probably, you know, Darren can speak to with his background in law enforcement. You know, we really want our police officers and sheriff's deputies to be cops. We want them to be able to handle those, you know, difficult situations that are, you know, that they're trained to do. And there's a lot of work that they have to do today that they weren't doing 10, 15, 20 years ago. You know, so to be able to provide these kinds of services in support of their true law enforcement role, I think is a big win for the county. Takes pressure off of them and hopefully puts people on a path to better outcomes than they would have seen otherwise. So my hat's off to you and to the whole public health team and our law enforcement community for embracing these alternatives to welcome them into the community, and it's exciting. It's exciting to watch it continue to grow. Great job.
Thank you, Commissioner.
And thank you, Abe, for all your work on these programs.
And not only is it an improvement for those involved, but it's got to be cost effective for our county. So, okay. So any other questions for Abe?
Just real quick, wanted to just let Abe know that I brag about you and Mason County all the time to all the other commissioners. And I do think that they're a little jealous with all of the programs that we have to help our people. It's easy to focus on the negative, but to see the positive it brings encouragement, I think, to those that really need it too. So thank you.
Exactly.
Yeah, absolutely. And I think now, more than ever, of course, hopefully on the heels of COVID, I think we're going to see a continued increase in the need for, SED and mental health support. So I think, moving forward, we're continuing to set ourselves up, hopefully for success now and in the future. So.
And thank you from the city, Abe. You're a great asset to the county. We appreciate you.
Thank you, Kathy. I appreciate that.
Okay. On to other business and board discussion. I see a little note here that Sharon might give us some information on the HB 1152.
That's the bill that everybody loves, right? All right, so 1152 is the bill that is trying to organize regional public health districts. There was a striker put on the floor, the House floor. It did pass, and now it's in the Senate. It'll be heard in the Senate on March 24th. The bill had a striker and it made it better, but it's still not good in my humble opinion. I don't think it's very good. It has a lot to do with counties that don't function as good as we do. And so it tries to bring them up to where we are. And so in reality, it's punishing those of us that are already doing an amazing job and have a great board, and our health officer is good, our health, all of our health department is good. It's not just COVID that right now they're focusing, I think, on just COVID, and they're not seeing the bigger picture, which includes environmental health and everything that we do. One of the things that does scare me about even in the striker, it says the county must pay for expenses incurred by the health district or county for enforcing proclamations of the governor during a public health emergency. That scares the living tar out of me, because that's going to add a lot more expense to counties that are already struggling. It does take away more local control. It gives a little bit back, but not much. Just reading through some of the testimonies from those that did testify, even those that supported the bill, you could tell that there's a lot of concerns still about how it's going to affect local counties and local control and local health officers. So it also develops, let's see, I think it's 3 new levels to the already struggling health program. So it's just going, in my opinion, it's going to add more cluster to the state mess.
Sharon,
Yeah.
how does that come out financially? Does that mean that some of our funds would be helped those lesser counties that are having a struggle?
Right. So it's funded by your life insurance policies. So every life insurance policy that you have will go to the state. That will send 65% of the funds to shared services. so that will be, so like, let's say that they partner us with the region that we're partnered with kind of now. So Kitsap, Jefferson, Clallam, and Mason. The county with the largest population would be the controller. So that would be Kitsap. So it would be much like, I equate it to some of the other committees that we already have going, let's say with Lewis, Mason, Thurston. Thurston typically will get the majority of the funds because their population is higher. So it might be based on the population, not on the need.
So the part of our life, something in the life insurance would go to the strongest county, which is Thurston.
It would,
That
well,
we-
yeah, first it would go to the state,
Okay,
and then the state would distribute it down to the different regions, and then it would go down to the districts. And then, and then you've got the administrative cost coming off the top, and that stays with the state.
okay.
Kathy, what it's similar, you look at it and say, okay, Mason County has finally reached a place where it's a respected county throughout the area. They're doing the right things on all cylinders. And Abe can tell you, before we started getting a seat with the Thurston Mason BHO, I mean, it's just like that. When you have these alliances that are formed through the state, we were members of the Thurston Mason BHO, and until 5 or 6 years ago, we didn't have a voice at the table. Thurston did. And as soon as we got a voice at the table, we end up with mental health services and everything else moving forward. So that's, for me, that's the scary issue there, is when you start to regionalize these things, the structure goes to whoever can win at the arm wrestling contest.
And it's usually those with a higher population and the stronger seat at the table. Yeah,
Right.
very,
Oh, okay.
yeah.
I've watched over my 20 years, many things be regionalized in the health area, and 99% of them have never worked out. And we always go back. And so it's really disappointing at the end of my career. I'm seeing they're going in the same direction again, that they keep finding doesn't seem to work very well. So
So
I think
in the long run, what can we do to prevent this from happening?
Yeah. Well, I am fighting like crazy by testifying, by writing letters to. So if you want to write letters to the Senate Committee on Health and Long-Term Care before March 24th and address
Which is tomorrow.
Yeah, which is tomorrow. You can sign up to testify. They have a ton of people testifying already, so it would be hard to testify. We have really good representation from the counties, from Wasac, from Wasalfo, from a lot of the organizations that represent, even AWB. So in the Association of Cities, Washington Cities, there's a lot of people that are testifying either opposed to the bill or with great concerns. And so I would say email Tim, Senator
Okay.
Sheldon,
Okay,
and let him know.
got it.
Yeah. And then
Okay.
if it passes through committee, then we'll fight it when it gets to the floor.
Sharon, can we just email Tim and say, I'm opposed to this,
Absolutely. Make it short.
and just leave it at that, or is that a
Yeah.
good enough one?
Yep, short and sweet.
Okay.
So any other questions for Sharon? Anybody else with information they want to present? How about any public comments? Hearing none, do I have a motion to adjourn?
I move that we adjourn.
Second.
Okay, all those in favor?
Aye.
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 Okay, we're adjourned. Thank you, everybody. Maybe next time we'll see you in person.